Hey guys, and welcome back to another Something in About 5 Minutes. Today we're tackling A and P of ventilation, so let's get started. The biggest thing that I want you guys to remember about ventilation is it's a process of air movement, okay? The process of pulling air into the lungs and exhaling air out of the lungs. That is ventilation. Respiration, on the other hand, is the process of gas exchange within the 600 million alveoli in the lungs. That gas diffusion of oxygen and carbon dioxide. That is respiration. Big terms that you absolutely need to keep separate. Okay? A lot of people put in ventilatory status as respiration and perfusion. Not so much. Ventilation is just the process of moving air in and out of the lungs. Think about when you ventilate a patient, you are breathing for them. You are putting air in the lungs and then taking air out of the lungs via a BVM or a ventilator or some other type of ventilatory management system. Now let's take a further look into how exactly the body does this ventilatory process. All right, guys, so on my diagram here, you always have to remember the biggest key for ventilation, and that is gas movement. Okay, gas always moves from a high pressure, to a low pressure. Okay? Always and always. This is always true no matter what the circumstance. Okay? Always will move from a high pressure to a low pressure. If we understand that, we can understand the concepts that we're going to be talking about. So inhalation, when we're bringing air into the nasopharynx, the pharynx, and down into the trachea right here, and into those bronchi and 600 million alveoli, we're doing a process of moving air from a high atmospheric pressure to a low lung pressure, okay? So we want a decreased lung pressure here, okay? And we want an increased atmospheric pressure. Okay? Almost didn't know how to spell atmospheric there. And how we accomplish this is the diaphragm. This major muscle that sits in between your abdominal and your thoracic cavity. It sits underneath, attached to the bottoms of the lung tissues, actually contracts. Okay? It moves downward when it contracts, increasing and pulling the lungs with it and increasing the size of the lungs. Now, what also happens along with this contraction of the diaphragm is the external intercostal muscles. These muscles on the outsides of your rib cage will also contract, and they will pull your rib cage outwards and upwards, along with the help of your neck muscles in pulling your sternum upwards to really pull that chest outwards. As these muscles will contract, the lung space gets bigger. The interthoracic pressure gets lower, okay? When you have a large lung, you have lower pressure, okay? So large lung equals low pressure, okay? Now think about this. Think about a 1 gallon of water going through a 5-inch fire hose, okay? There is going to be very little pressure because it's such a small amount of water going through a large hose. However, if you have that same gallon of water going through a 1/2-inch hose, it's going to be increased pressure. Okay, so a large vessel equals smaller pressure. When we increase the size of these lungs, we're now lowering the pressure. This is now when the higher atmospheric pressure will start to move through and get pulled into the lungs. This is a passive process. We don't do this, okay? This happens on its own. It's a passive process. It just slides right in. Okay, now when we're done with gas exchange and we have to exhale, all of these major muscles are going to relax. Okay, first the diaphragm. right? Over here, now we're looking on the right side, the diaphragm will go from a lower contracted position. It will relax and move back upwards, pushing those lungs back upwards, creating a smaller lung. These muscles out here, the external intercostals, will now relax. And the internal intercostals, the muscles on the inside of the rib cage, will now take over and pull the rib cage back downwards, as well as the neck muscles will relax and they will allow the sternum to come back to the normal position, all while decreasing the size of the thoracic cavity and decreasing the size of the lung. Okay, so now because the lungs are smaller, we have an increased lung pressure. Okay, remember, we already said that large equals a lower pressure, so that means small must equal a higher pressure. Okay, remember that 1 gallon of water going through a 1/2 inch hose, that's going to have a higher water pressure than the 1 gallon of water going through a 5-inch wide hose. Okay, so as the lung pressure increases, it becomes more pressure than the atmospheric pressure. So at here, there's lower atmospheric pressure and diffusion of gases from a high pressure, okay, to a low pressure will then occur. Well, guys, that's it for today's video. I really hope that this makes sense to you. That is a really down and dirty quick look at the anatomy of the muscles that need to be able to contract and relax for ventilation and moving that chest wall to make those lungs bigger or smaller. Guys, stay safe out there, and I will see you next Tuesday.